How Southern states are addressing healthcare disparities. Healthcare disparities are a significant issue in Southern states, where factors such as poverty, access to care, and systemic inequalities contribute to uneven health outcomes. States in the region are employing various strategies to address these disparities and improve healthcare access and quality. Here's an overview of the efforts being made. 1. Expanding Medicaid coverage. Several Southern states have expanded Medicaid under the Affordable Care Act, ACA, to increase access to healthcare for low-income residents. Louisiana and Virginia are examples of states that have expanded Medicaid, providing more residents with access to essential health services and reducing the uninsured rate. 2. Investing in community health centers. Community health centers play a critical role in providing care to underserved populations. States like Georgia and Alabama have increased funding and support for these centers to enhance access to primary care, dental services, and mental health support in rural and low-income areas. 3. Enhancing telemedicine services. Telemedicine has become a valuable tool for reaching individuals in remote or underserved areas. Mississippi and Tennessee are expanding telehealth services to improve access to care for those in rural communities, allowing patients to consult with healthcare providers without having to travel long distances. 4. Improving maternal and child health programs. Southern states are focusing on programs to address disparities in maternal and child health. South Carolina has implemented initiatives like the South Carolina Birth Outcomes Initiative to improve prenatal care and reduce infant mortality rates, particularly among underserved populations. 5. Addressing social determinants of health. Understanding that health disparities are influenced by factors beyond healthcare access, states are addressing social determinants of health such as housing, education, and employment. North Carolina has launched programs to integrate health services with social support services to tackle these broader issues. 6. Expanding access to behavioral health services. Mental health and substance use services are critical components of overall healthcare. Arkansas has worked to expand access to behavioral health services, including increasing the availability of crisis intervention services and integrating mental health care into primary care settings. 7. Promoting health education and outreach. Public health campaigns and educational programs are used to raise awareness and encourage preventive care. Alabama has launched initiatives to promote healthy lifestyles, improve nutrition, and increase awareness of preventive screenings to address chronic conditions prevalent in the region. 8. Strengthening healthcare workforce in underserved areas. Southern states are working to address shortages of healthcare professionals in underserved areas by providing incentives and support for those who practice in these regions. Kentucky offers loan repayment programs and scholarships for healthcare workers who commit to serving in rural and low-income areas. 9. Implementing targeted health initiatives. States are developing targeted health initiatives to address specific needs of diverse populations. Florida has programs focused on improving health outcomes for Latino and African American communities, addressing unique health challenges and barriers to care within these groups. 10. Collaborating with community organizations. Partnerships with local community organizations help enhance outreach and effectiveness of health programs. Texas collaborates with nonprofits and faith-based organizations to provide health services and education to underserved communities, leveraging local knowledge and networks. By implementing these strategies, Southern states aim to reduce healthcare disparities and improve access to quality care for all residents. These efforts reflect a growing recognition of the need to address systemic inequities and promote health equity across the region,